Yeah, hi, this is Dr. Zuckerman again. Now we're going to talk about warts. The Remy laser system is very unusual. Again, it's multifunctional. With warts, it's covered. Insurance will cover this. It's a global period of 10 days. There's no anesthetic necessary. It does warts and porokeratosis, plug sweat ducts. You can do it under a metatarsal bone weight bearing. It's not as effective. It's over 90% effective for porokeratosis when you're doing it. But if it's weight bearing, because it's the bone that's causing the problem. So we're going to talk about how to set it up, how to clean it, how to use it. What's important is take your time. That's what's important. There's no rush with this. So this is the therapy handpiece. Don't take it off with the blue ring. Go below it and unscrew it. Below it. If you unscrew this, I can fix it, but you go below it. Okay? Then this is the surgical handpiece. You put it on, and then you have, we call them the wart tips. Looks like a needle. You take the top off. They come in these plastic bags. You take the plastic off here and you stick it in and you push it down and turn it. It locks in place. You turn it on the mosaic wart program, not the surgical, even though there is a surgical program, which if you want to learn, I can teach you how to anesthetize it. And this is like a 15 blade and it'll cut it out. But we're talking about no anesthetic. Great for children. In fact, we use this in the UK for hands, for feet, full body warts. So, key thing is, do not debride the wart. Very important. There is a little bit of learning curve with this, okay? You don't want to debride it because what could hurt if you go too fast and debride it is heat can build up. So you turn it on, hold this very lightly, and it's touch, pull back. It's on right now. Touch, pull back. Very, very light. Touch, pull back. Touch, pull back. Touch, pull back. There's a little bit of a learning curve. If it's a little warm, slow down. It's not peppering it. Boom, 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 boom. Do not hold the handpiece, the tip over it, and look for the wart. Touch it, pull it away. I want it out of the heat range. Let's say you have a sensitive patient. You can take the pain therapy 25 and you can treat the whole area, just like you're doing plantar fasciitis, Achilles. Remember, I told you when you're doing pain therapy, it anesthetizes it. Very rare you should have to do that. I had one podiatrist, he had it all over his knee, and I wanted to treat him, so we did that. If you're doing a lot of the pain, the therapy to numb it first, there's no needles with this. You can use the pain therapy, it'll anesthetize it, but that's very rare. If you're doing a lot of it, I want to talk to you because you're going too fast. I will be sending you videos, and I will be sending you, there's two techniques. One is the touch. I have pre and post. We've been doing this for years. We have hundreds of these doctors doing this. There's the non-touch, which is done in San Juan, Puerto Rico. They see a lot of warts and porokeratosis. I think it's a great procedure. You can do it if you have a sensitive patient. You don't touch it. Okay, just get as close as you want. Now, when you're doing this technique, and we'll show you a video, it just turns a purplish reddish, and you're done. The treatments per lesion are about 30 to 60 seconds. When you're doing the touch procedure, where you're in contact, remember, go very slow, you're done, not by the time, it's when it turns brown, black, a little bit of white. You're done. It's not the time. So you turn it on, again, touch, pull back, touch, pull back. I want to talk about cleaning it. During the procedure, you could get a little char when you're doing the touch contact. Always, you're going to get a gauze pad saturated with water. You're going to continue to wipe this off. You don't want the char to build up because the laser energy will go right to the tip and it'll act like a branding iron. So you wipe it off during the procedure. Also, keep these tips. It is a consumable. It could last 5-10 times, even longer if you keep it clean. You can autoclave these. So I want you to always keep the char off this because once it hardens, it's done. So you wipe it off. You can cold sterilize this, or you can steam autoclave this and a sterilization. So the key is keep it clean and go slow, very slow. And the last thing I want to talk about is insurance coverage. There's a global period of 10 days, so you do it every 10 days. In Europe, they only do it once a month because they're not involved with insurance. But you use the standard Wart code. I think it's 17000, the Wart code. And that's really how it works, except for one thing that's important. When you do the touch, okay, it's going to build a little smoke. Take that gauze pad saturated with water that you use to clean this off. If it's smoking, just put the gauze pad right over it. It absorbs it. There are smoke evacuators that we can talk about. If you're interested in that, I can help you get one of those. But the gauze pad with water is very, very effective. How does this work? It's simple. And this is in the literature. Lasers stimulate the immune system, and they also coagulate the capillary bed, so it's two parts. It takes some time. You don't need any sal acid at all. I recommend using Poto Expert, which is an excellent product. It comes from Germany, and it's evidence-based, peer-reviewed, published. It repairs the lipid barrier. When you have warts, fungus toenails, dried cracked skin, the lipid barrier is damaged. Poto Expert, after you do the warts, you put it on twice a day. It will repair the lipid barrier in less than 30 days. And this is evidence-based. I can show you the literature and the publication. They did biopsies and showed under electron microscope the repair. It's a game changer. Happy to give you more information about that, and I hope this was helpful. Thank you.